This is Willis Courtney, MD, from Thought Productions Entertainment. I know someone out there has to be wondering what is going on with the new healthcare. Well, I'm here to break it down for you in words that have never been spoken, at least not until now, which is this doctor's point of view, like a color representing a particular hue. So for all you out there without a clue, what I'm about to tell you is not fiction but true. The physician's perspective. The physician is not a laborer, but an artist with strong desire and will, like painting a Rembrandt. This also takes skill. The clinic is the canvas, his or her skills is the brush. Restoring the health of the patient is the masterpiece, so the doctors cannot rush. The physicians are an extension of God's healing hand. They must be, why else are they a part of his plan? When a physician's skills are not hindered and allowed to spread, he or she can assist many off their deathbed. 12 to 15 years or more after high school to master a trade, and now you're telling the doctors they won't get paid? It's like being on an island surrounded by a shark-infested ocean, attempting to block any hope of a promotion. A sculptor or painter, their talents and techniques you respect, but the doctor's trained method of treatment you now reject. Politicians calling many of us liars and thieves, and even suggesting that our clinical skills are subpar. And these are just some of the accusations listed so far. The government pays us, then takes the money back. They didn't even return the money we paid in tax. Although this sounds absurd, it's actually fact. Politicians claim that adequate health care can be obtained at a minimal cost, so millions of lives are potentially lost by the political games they play each and every day. Rules and sanctions intended for our demise, false pretenses masquerading in disguise. This is the kind of stuff we hate, being treated like criminals or enemies of the state. Now, I don't play poker, but I'm trying to hold them while I watch many of my colleagues give up and fold them under the strife, letting go of everything, even life. Like a linebacker or strong safety in the secondary on the hunt, or an offensive line that's so shady you don't have time to punt. Like a carpenter that has your dominant hand in a vice, still expecting you to only cut once without measuring twice. Auditors and lawyers coming out of woodworks running amok. Doctors screaming like a gambler, having a string of bad luck. Doctors now sad and blue, still can't believe that what's happening is true. Doctors scrambling to get above the political wave, trying not to end up like Davy Jones' locker, buried beneath a watery grave. I know this new healthcare system is whack, but that's what happens when doctors known and unknown are under attack. This and that medical code. Doctors now operating in what we call beast mode. New government regulation forcing doctors to use computers, hunt, peck, and click. And you wonder why the doctors are getting out of the profession quick. No more patient encounters face to face, doctors ripping and running, trying to keep pace. Patients sitting on the exam bed, looking at the back of the doctor's head like lions on a Serengeti. Doctors are predators of illness, not prey, but now the physicians are hunted, causing their manes to turn gray. Blessed with the ability to handle crises regardless of how many, simultaneously fighting the government who won't pay them a penny. There's always some new update or diabolical caper. Although the physicians are doing the heavy lifting, someone else collects the paper. Now the government is trying a new thing, attack the doctors and hope they will hang themselves from a string. Day in and day out with long grueling hours are compared to climbing the smoking twin towers. Doctors doing their best to attend to the patient's needs. The demands are endless like countless out of control weeds. Penalized for addressing the patient's concerns and what they want. Sued by the lawyers if they don't. I wonder if people are aware or even concerned about the declining health care. Soon the physicians you once knew would no longer be available because they are through, exhausted from the madness, stresses, and strains, fed up with dealing with politically induced migraines. I can understand some people's dismay. Doctors now having a coward-like display in their behavior with facial expressions similar to a frown. Kinda like the soldiers in the movie Black Hawk's Down. When more things in life are going wrong rather than right. When the doctor's world is falling apart, loose instead of tight. When working hours are constant, not 9 to 5. When death seems less scary than staying alive. When the doctors feel they no longer have a voice and decide that suicide is an appropriate choice. The crisis will hit like a tsunami. Without the physicians, who would care for your mommy? The politicians say, what about the oath the doctors took? When everyone knows They are the real crooks. It has been said that life is precious. Most physicians believe this is true, so we will see if the government thinks the physician shortage is a crisis or it's simple as treating the flu. And for all you doctors out there, I did this just for you.